Every single day, your body is sending signals. Most of them are harmless, but some could be early alarms of something far more dangerous. According to the World Health Organization, cancer claimed nearly 10 million lives in 2020 alone. What makes it even scarier is that many of these cases could have been caught earlier if only people had recognized the warning signs. The truth is, cancer rarely begins with a visible lump or dramatic bleeding. Instead, it often starts with subtle, everyday changes that are easy to ignore. Feeling unusually tired, losing weight without trying, or struggling with small infections that don't go away. Most of us shrug them off as stress, age, or just being run down. But for some, these are the first whispers of malignancy. Doctors call these symptoms systemic red flags because they don't just point to one organ but reveal the entire body is under attack. And while they may seem unrelated, when you put the pieces together, they form a powerful early detection map. In this video, we're uncovering 7 hidden signs your body may show before cancer becomes severe. From fatigue so crushing that even sleep can't fix it, to neurological changes where your immune system starts attacking your own brain, each one carries a story backed by medical research, real patient cases, and expert advice. Some of these signs may surprise you. Others may feel uncomfortably familiar. But knowing them could mean the difference between catching cancer early or finding it when it's already too late. Stay with me, because what you're about to learn might just save a life. 7. Mental and neurological changes. When cancer begins to affect the nervous system, the signs can be both subtle and alarming. Unlike pain or weight loss, neurological changes often catch people off guard. Doctors call this phenomenon paraneoplastic neurological syndromes. It doesn't mean the cancer has spread directly to the brain. It's far more complex. In these cases, the body's immune system, while trying to fight the tumor, mistakenly attacks healthy nerve tissue. Think of it as friendly fire. The same antibodies and T cells meant to destroy cancer end up damaging the brain, spinal cord, or peripheral nerves. These changes can appear in many forms. Some patients develop cerebellar degeneration, where balance and coordination deteriorate, leading to stumbling, slurred speech, and involuntary eye movements. Others may experience limbic encephalitis, which disrupts memory, mood, and behavior, sometimes even triggering seizures. What makes this particularly dangerous is that these symptoms often precede a cancer diagnosis by weeks or months. For example, a 42-year-old woman reported an Oxford academic developed tinnitus and difficulty walking long before doctors uncovered an underlying breast tumor. Even after the cancer was removed, her neurological decline continued, leaving her wheelchair-bound. Such stories underscore why these signs should never be dismissed as simple stress, aging, or just being forgetful. In fact, Mayo Clinic emphasizes that paraneoplastic syndromes are rare but powerful early warning systems, often pointing to hidden cancers of the lung, breast, or ovaries. If memory loss, sudden confusion, or coordination problems develop rapidly, especially alongside other unexplained symptoms like weight loss or fatigue, it's critical to push for a neurological evaluation. Keeping a written log of symptoms, their timing, and severity can greatly help doctors identify patterns. From a molecular perspective, researchers have identified anti-Hu and anti-Yo antibodies as common culprits in these syndromes. Their detection in blood or cerebrospinal fluid can guide doctors toward both a neurological and cancer workup. While treatment often requires addressing the cancer itself, some patients also benefit from immunotherapy, which calms the immune system's misguided attack. In short, mental and neurological changes are not just psychological side effects. They can be the body's way of sending a desperate signal. Recognizing them early and connecting them to possible cancer could mean diagnosing the disease months earlier, when treatment has the highest chance of success.
6. Frequent infections and slow healing.
One of the body's most overlooked warning signs of cancer is when you start catching infections again and again, or when small wounds take far longer to heal than normal. At first glance, this might feel like a weak immune system due to stress, age, or even seasonal flu. But in cancer, the explanation goes much deeper. Cancer is not just a lump of abnormal cells growing inside you. It actively manipulates the immune system to protect itself. Tumors release powerful chemicals like TGF-B, transforming growth factor beta, and IL-10, interleukin-10. These aren't random byproducts. They are immunosuppressive signals that directly shut down the body's main defenders, T cells and natural killer cells. In other words, the cancer is hacking your immune system so it can grow undisturbed. The result? Patients begin experiencing frequent fevers, sore throats, chest infections, or urinary infections that keep coming back. On top of that, wounds, like a small cut on your hand or even mouth ulcers, can linger for weeks. According to Holland Fry Cancer Medicine, this is because tumors also alter metabolism in their surrounding environment, literally starving immune cells of essential amino acids they need to function. Without strong immunity, the body struggles not only to fight infections, but also to repair tissue. A review in MD-PI Cancers Journal explains that patients with certain cancers, especially blood cancers like leukemia or lymphoma, often present first with stubborn infections before the malignancy itself is discovered. In fact, some oncologists consider repeated, unexplained infections a red flag symptom that warrants deeper investigation, particularly when combined with fatigue or unexplained weight loss. If you notice that minor wounds, gum bleeds, or skin scratches are healing unusually slowly, or if you're battling recurring infections without clear cause, it's worth discussing with your doctor. Keep a record of how often infections occur and how long healing takes. This small detail can make a big difference in early detection. Ultimately, slow healing and frequent infections are not just random inconveniences. They are signs that the body's defense army has been compromised, often by the very cancer it is trying to fight. Recognizing this early could open the door to life-saving investigations before the disease progresses too far. 5. Breathing difficulties and shortness of breath. Few symptoms are as frightening as suddenly feeling like you can't get enough air. Shortness of breath, or dyspnea, is often brushed off as asthma, anxiety, or a lingering chest infection. But in cancer, it can be a sign of something far more serious. One major reason is mechanical obstruction. A tumor growing in or near the lungs can physically block airways, making breathing difficult. But that's only part of the picture. In many patients, cancer causes what's called a malignant pleural effusion, a buildup of fluid around the lungs. Normally, a thin layer of fluid in the pleural cavity helps the lungs expand smoothly. But when tumor cells spread there, they block drainage pathways and release inflammatory molecules that cause fluid to accumulate. This fluid literally presses on the lungs from outside, leaving patients gasping for air. Breathlessness can also result from systemic effects of cancer. For example, advanced cancers often cause anemia, a shortage of red blood cells. So even if the lungs are healthy, the body can't transport enough oxygen. Add in cancer-related muscle wasting, cachexia, which weakens the respiratory muscles, and even lying down can feel suffocating. A clinical report in Yale Medicine notes that up to 70% of patients with advanced cancer experience dyspnea, and it's one of the most distressing symptoms, often worse than pain. In fact, patients frequently describe it as a drowning feeling that triggers panic, which then worsens the breathlessness in a vicious cycle. If you or someone you know feels breathless even at rest, or finds it hard to breathe when lying flat, seek medical attention quickly. Simple diagnostic steps like a chest X-ray or ultrasound can reveal if fluid, tumors, or other abnormalities are behind the symptom. Doctors at Johns Hopkins emphasize that breathlessness in cancer is not always about lung disease. Sometimes it's a combination of heart strain, anemia, and fluid buildup. That's why oncologists treat it with a multi-pronged approach, draining pleural fluid, giving oxygen, treating anemia, and strengthening respiratory muscles. So, while breathlessness may feel like just another chest issue, in the context of cancer, it's the body's urgent alarm bell. Paying attention to it early can not only bring relief, but also uncover cancer at a stage where treatment is more effective. 4. Persistent pain. Pain is something most of us dismiss. A backache? Probably from sitting too long. Chest pain? Maybe stress or acidity. But when pain is persistent, unexplained, and resistant to normal medicines, it can be one of the earliest and most overlooked signs of cancer. Here's why. Cancer pain isn't just about a lump pressing on nerves. Tumors act like tiny chemical factories, releasing substances that irritate and inflame surrounding tissues. For example, molecules like endothelin-1 and nerve growth factor, NGF, sensitize pain receptors, while the acidic environment created by rapidly growing tumors directly triggers nerve endings. This means the pain is not random. It's a result of the tumor actively changing its microenvironment. The type of pain often depends on where the cancer is. Bone metastases, common in breast, prostate, and lung cancers, can cause a deep, aching pain in the back or legs. If a tumor presses against nerves, the pain may feel sharp, shooting, or burning, much like sciatica. Abdominal cancers may produce a constant, dull ache that never truly goes away. A case reported in Patient Power described a man with persistent lower back pain who thought it was a slipped disc. Months later, scans revealed bone metastases from prostate cancer. This story highlights how easy it is to misinterpret oncological pain as a routine musculoskeletal issue. If pain lingers for weeks, keeps worsening, or wakes you at night, especially if paired with weight loss or fatigue, it deserves immediate medical evaluation. Don't rely solely on painkillers. They may mask symptoms but won't solve the underlying cause. According to the National Cancer Institute, NCI, up to 80% of patients with advanced cancer report moderate to severe pain, making it one of the most common late-stage symptoms. But here's the critical part. Pain can occur even in earlier stages, and catching it then can mean diagnosing cancer before it spreads. Doctors recommend tracking pain carefully, using a simple 0 to 10 scale for intensity and noting its location and pattern. This transforms pain from a vague complaint into a clear clinical signal that helps oncologists identify the source faster. In short, persistent, unexplained pain is not something to tough out. It may be the body's way of whispering that something serious is happening beneath the surface, sometimes months before cancer reveals itself in other ways. 3. Loss of appetite and difficulty swallowing. We all skip meals sometimes. Stress, fatigue, or a bad mood can kill our appetite for a day or two. But when you begin to lose interest in food consistently or find it hard to swallow even small bites, the body might be signaling something more alarming. In cancer, appetite loss isn't just about not being hungry. Tumors release inflammatory molecules that disrupt hormones controlling hunger, such as ghrelin and leptin. The result? Even your favorite foods feel unappealing, and a few spoonfuls leave you uncomfortably full. This is one of the earliest drivers of cancer cachexia, a wasting syndrome where the body breaks down muscle and fat regardless of how much you eat. Difficulty swallowing, or dysphagia, is another warning sign. Sometimes it happens because of a mechanical blockage, a tumor in the throat, esophagus, or stomach narrowing the passage of food. But it can also be neurological. Certain cancers that spread to the brain disrupt the swallowing reflex, making even liquids hard to manage. A report from MD Anderson Cancer Center describes patients who initially complained of food sticking in their throat. Many delayed seeking help, assuming it was acid reflux. Later, tests revealed esophageal tumors. The delay meant treatment started at a more advanced stage. If you notice that you're losing weight without trying, or if swallowing feels painful, delayed, or like food is getting stuck, do not ignore it. A simple endoscopy or imaging scan can uncover structural or functional issues early. According to the Mayo Clinic, dysphagia linked to cancer can progress from mild discomfort to severe choking risk if untreated. On the systemic side, loss of appetite is common in multiple cancers, including stomach, pancreatic, and lung cancer, where up to 50% of patients report anorexia even before diagnosis. The tragedy is that these symptoms are often misattributed to stress eating less or just aging. Yet medically, they represent a breakdown in one of the body's most basic survival drives, nutrition. Left unchecked, they accelerate weakness, reduce immunity, and make recovery harder even if treatment begins. So if the joy of eating fades without reason, or if swallowing becomes an unexpected struggle, listen closely. Your body may be alerting you not just to poor digestion, but to something far more serious that needs urgent medical attention. 2. Sudden, unexplained weight loss and muscle wasting. Most people celebrate when the scale drops a few kilos, but when weight slips away without dieting or extra exercise, sometimes 5 to 10 kilos in just a few months, it's not a victory. It can be one of the clearest warning signs of cancer. Doctors call this condition cancer cachexia, a dangerous syndrome of involuntary weight loss, muscle wasting, and weakness. What makes it especially alarming is that it's not simply about not eating enough. Cancer actively rewires the body's metabolism. Tumors and surrounding immune cells release inflammatory molecules like IL-6 and TNF-alpha, which increase the body's resting energy use. At the same time, proteins like myostatin and activin trigger muscle breakdown, while growth pathways like IGF-1/AKT are suppressed. The result is a body burning itself away, unable to rebuild muscle even if calories are consumed. A striking case report in Annals of Clinical Case Reports described a 54-year-old man with esophageal cancer. Within 2 weeks, he lost 4.4 kilograms, nearly 9% of his body weight. His condition quickly spiraled with anemia, weakness, and difficulty swallowing. Only after a comprehensive treatment plan, including nutrition therapy, metabolic support, and cancer treatment, was his cachexia reversed, with a regain of almost 10 kilograms and restored muscle mass. This shows 2 key truths. Cachexia is not simply starving, it is metabolic warfare waged by the tumor. And with timely, multifaceted care, it can sometimes be stabilized. If you or someone you know loses more than 5% of body weight within 6 to 12 months without trying, doctors recommend immediate evaluation. This symptom has a cancer predictive value similar to red flags like blood in stool or coughing up blood. Research published in the BMJ found that in patients over 60, unexplained weight loss carried a cancer risk above 3%, enough for doctors to recommend urgent investigation. And globally, cachexia is estimated to contribute directly to up to 22% of cancer-related deaths. In short, unintentional weight loss may feel silent, but it is one of the body's loudest alarms. When combined with fatigue, loss of appetite, or pain, it's a sign to act fast. Because the earlier the root cause is found, the better the chances of halting the wasting cycle and regaining strength. Extreme, persistent fatigue. We all feel tired after a long day, but cancer-related fatigue, CRF, is very different. It's not the kind of tiredness a good night's sleep can fix. Patients often describe it as a deep, unshakable exhaustion, where even basic activities like walking across a room or eating a meal feel overwhelming. From a medical standpoint, this fatigue is more than just low energy. It's a systemic condition. Studies show that up to 90% of cancer patients report some level of persistent fatigue. What makes it unique is the biology behind it. Cancer and its surrounding environment release pro-inflammatory cytokines, chemical messengers like IL-6 and TNF-alpha. These molecules don't just stay local. They travel through the blood, crossing into the brain, and disrupting normal function. This creates a state of chronic inflammation, tricking the body into feeling constantly sick and drained. At the same time, cancer disrupts the hypothalamo-pituitary-adrenal HPA axis, the system that regulates stress hormones like cortisol. Normally, cortisol rises and falls in rhythm with daily activity. But in fatigued cancer patients, studies showed this rhythm becomes blunted. That means the body loses its ability to balance stress and energy, trapping patients in a cycle of exhaustion. Anemia, common in many cancers, adds another layer. With fewer red blood cells to carry oxygen, tissues become starved of fuel. Even if you rest, your muscles and brain never fully recharge. This is why CRF feels so different from normal tiredness. It's rooted in cellular and hormonal dysfunction, not just physical exertion. A study in the Journal of the National Comprehensive Cancer Network went so far as to recommend that fatigue be treated as a vital sign, screened at every clinical visit, because it directly predicts prognosis and quality of life. If you feel persistently drained for weeks, despite adequate rest, and especially if it comes with weight loss, pain, or infections, don't dismiss it as stress or getting older. Keeping a fatigue diary, noting severity, timing, and triggers can help doctors connect it to possible underlying illness. Dr. Carmen Escalante of MD Anderson Cancer Center emphasizes that patients should never just live with it. Persistent fatigue is a message from the body, sometimes one of the earliest, that something as serious as cancer could be at play. In short, extreme fatigue is not just tiredness. It's a biological alarm bell. Listening to it early could mean the difference between catching cancer at an advanced stage or in time for effective treatment. Cancer rarely announces itself with one dramatic symptom. More often, it whispers through fatigue that won't go away, weight loss you can't explain, or wounds that take forever to heal. Each of the 7 signs we've discussed, extreme fatigue, sudden weight loss, loss of appetite, persistent pain, breathlessness, frequent infections, and neurological changes, may seem unrelated on their own. But together, they form a language, the silent alarms of malignancy. What makes these signs so dangerous is how easily they're dismissed. Fatigue gets blamed on work stress. Weight loss feels like a lucky break. Chest tightness might be written off as asthma. Memory lapses are excused as aging. Yet behind these common explanations, something far more serious can be unfolding. Medical research is clear. Many of these symptoms are driven by deep biological processes, from tumors hijacking metabolism to immune systems misfiring and even the brain being attacked by the body's own defenses. That's why oncologists stress vigilance. In fact, the World Health Organization reminds us that early detection remains one of the most powerful tools in improving survival, and subtle systemic symptoms are often the first opportunity to intervene. If you or someone you love experiences a cluster of these signs, especially if they are new, persistent, or worsening, document them. Write down how long they last, how they feel, and how they change over time. Bringing this record to a doctor can help move the conversation from vague symptoms to actionable medical evidence. It's also important to remember, these symptoms don't always mean cancer. They can arise from many conditions, some less serious. But ignoring them or hoping they'll just fade carries risk. As one oncologist put it, when in doubt, check it out. Time is the one factor we can't replace. Looking ahead, new technologies like multi-cancer early detection blood tests are on the horizon, capable of identifying cancers before symptoms appear. But until those become widely available, the body remains our best messenger. So the lesson is simple yet urgent. Listen to your body's whispers before they become screams. Whether it's relentless fatigue, sudden weight loss, or a wound that won't heal, these signs deserve attention. Early action doesn't just improve outcomes, it saves lives.